I've enjoyed it enormously. It's been absolutely fabulous. First of all, every session has actually interested me, which doesn't always happen for a patient advocate at these conferences. I have understood most of what the speakers are actually saying, but I could see the implications for running clinical trials which are going to help patients, which is why we're all here.
Yeah, the conference so far has been great. It's been very busy. I think there's been very good attendance. We've had lots of people coming into our booth. In terms of the talks, I think it's been really nice to have a good variety, and also I think there's been very good representation from some different regulatory bodies, and having them giving some panel discussions and talks I think has been a very interesting experience.
The panel was fantastic because there were 2 regulators there from DHSE, MHRA, and then 2 of us from a sponsor giving that perspective. So it's really emphasising that partnership that can really sort of progress us in the future.
So far it's been great. This is my first OCT UK and Ireland that I've been to. I've been to several OCTs in the States, so it's been a privilege to be part of this, to have an opportunity to give a presentation. Very great wonderful to meet several of our clients out here, and it's been highly engaging.
It has been an exhilarating experience, to be honest. It's been very positive. There are so many vendors here that I managed to talk to, so many different aspects of clinical trials that are covered, which I think are super helpful. I work in biosample operations, so I find it extremely positive. There is a few booths that actually do something with that, like a central lab, and there is the vendor who has the shipping boxes, which I didn't know existed. So I've learned so much. It's been really great educational. It has been quite tiring, but in a very positive way, and honestly the organisers did a really, really good job.
It's been good, yeah. It's been great attendance. There's been good traffic at our booth, which is always nice for the sponsor. And yeah, there's clearly an appetite for knowledge, which I think is always really encouraging.
The conference so far, it's been a real mix of both the sponsors. It's been great having the MHRA here, as well as the vendors, with the ways that clinical trials is going, and there's been a number of talks about site feasibility and how the sites, we engage with the sites.
Yeah, again, I think it's just the vibe here. There's lots of vendors. So it's great to see what's available now on the marketplace, but equally lots of sponsors, lots of sites. So it's been some good discussions, both in the rooms and in the breaks.
We gave a presentation yesterday, and following that, we had a very good aftermath of the presentation. We had a lot of people come to us and say how amazing that the talk was, and how they learned a lot from it.
It's a wonderful event. Like, we had a great conversation with key stakeholders. For the last 2 days, we have been engaging with CROs, pharma, and also the clinical research sites, trying to understand their deep challenges and how we can support them in the journey is something we have been exploring.